axis is. Okay, उसको हटा दें. Now there are two ways to develop your axis. You can go the manual way. The best way, if you have to go manual, is the axis reference marks of 0, 180 on the slit lamp. But that takes a little time because you have to go from one machine and then to bring the patient to the table.
Yeah, in Varian we don't need referral marking, correct?
Yeah. And the second best way is the bubble marker. So bubble marker, the patient is on the table, you mark the reference marks there only and ask the patient to lie down. And the third option is the digital, where you don't need reference marks. The Varian checks the blood vessel, which is the most prominent, gives an angle to it, and from that basis it decides the angle for you on the eye.
Because referral marking is always done in the sitting position, because once the patient lies down, there is a torsional movement, so referral marking will not be 90, 180 axis will not be correctly marked.
Perfect. So we move on. So a two-port surgery, the direction should be towards the endothelium, because you do not want to risk touching the lens capsule. So the direction is upwards towards the endothelium. If you touch the endothelium, it's not an issue, but in no way you should be touching.
And one thing more, once we are entering the eye, never press the lower lid, just to avoid collapsing the temple. It has filled up nicely anterior chamber with viscoelastic, so the chances of touching the lens with the blade is very low.
Which is 3.2 millimeters.
Now, like Dr. Sanjay has filled up nicely anterior chamber with viscoelastic, so the chances of touching the lens with the blade is very low.
So now, the ICL comes in a bottle like this.
Yeah, the most important part in ICL implantation is the loading part. So loading is the most
important thing to be done. So you just sponge.
So you get the ICL out, and if you can see, the right leading haptic and the left trailing haptic, they have a hole. So that is how you come to know the right direction of the ICL, and that the ICL is not in the upside down position. So you would have options where the leading haptic can have a hole in the left eye, in the left haptic. So other companies are doing that, and there are some companies which are giving it the leading haptic in the right. So you have to know beforehand the lens you are using and where the trailing hole is and the leading hole is, right? Okay, now this is the cartridge filled with visco. I am placing the ICL here. So this is a siliconized foam. This is the ICL in position with a little bit coming out from the edge of the cartridge. And now to load, with the sponge, I am not holding it in the center, but a little in front of the center, and I turn it around like this, anti-clockwise. And when I turn it around anti-clockwise, the ICL will turn clockwise like a gear mechanism, and it will immediately fall into position. We have realized that a lot of beginners have a problem in loading the ICL. So this technique works very well, and let us see if it works equally well during this live demonstration. So hold it here, press, and it comes in, right? So this is the ideal position for the ICL. So now this is alligator forceps, because इसका मुंह थोड़ा बड़ा हो.
This is special forceps dedicated for the ICL only.
Okay, so this is the mouth of the alligator forceps. It should open up well like it is opening up now. Press it.